Anushka is the founder of Dr. Legal. It's a medico-legal consultancy supporting healthcare professionals through to practice ethically, lawfully, and in accordance with our regulations. She's got a background in law and extensive experience working alongside doctors, nurses, and allied professionals. She specializes in the practical application of healthcare law and ethics, and she's known for her ability to translate complex things into simple language for us to understand clearly. She consults, teaches, and presents nationally. Anushka, welcome to our stage, and thank you very much for being involved.
Thank you so much. Thank you, everybody. Good afternoon, all you good people. I wonder if you get that often, GPs, good people. I really hope so, because you are. And if you needed a reminder today, then I hope that I can be that reminder for you. Before I begin, I would like to ask you something. And I'd really like you to answer honestly, and even if it's just to yourself. How many of you, in the course of your normal practice, have ever sent a patient image or a colleague a message on WhatsApp, asked reception to email results, or left a file at reception for collection? I see some faces really guiding me to yes. And I'm not asking you this to catch you out, doctors. I'm asking because this is exactly how practice is run, and this is how medical practice works. But here's the uncomfortable truth. Every one of those actions has the potential to be a POPIA breach. And the reality is that almost every doctor sitting here has done at least one of them, and not because you're negligent, but because your systems and workflows have evolved faster than what the law can keep up with. My name is Anushka Singh Bhima from Dr. Legal, and today we are not going to focus on the legislation or the abstract of what POPIA is. We're going to focus on what is actually happening inside your practices every single day, and how very normal routine processes can quickly become a medico-legal risk. Let me show you just how small and how real the risk really is. A doctor receives a call from a patient who's extremely distressed. The patient asks, "Doctor, why is my HIV status being discussed at my workplace?" Now, just take a moment to imagine receiving that call. Your immediate reaction is, this cannot be possible. You've not disclosed the information to anyone. You know you have followed your ethical duties and that you've maintained your confidentiality. But on further investigation, something interesting is discovered. The doctor did not disclose the information. The system did. The lab results had been printed and placed at reception for collection. Another patient sitting in the waiting area noticed the document, stood up, and while asking the receptionist a question, noticed the file. The patient's name was clearly written on the file, and so was the diagnosis. Within a matter of hours, that information was disclosed to a patient. There was no hacking, no cyber attack, no malicious intent. Just one moment of exposure during a routine administrative process. Within 48 hours, the doctor faced a complaint via the HPCSA and a complaint to the information regulator. This is the reality of the POPIA risk in healthcare. It's almost always operational. And it raises a question I want you to sit with for a moment. Could this happen in your practice? For most practices, the answer is yes. Every patient interaction in your practice creates a risk, but not just the clinical one. It creates information risk. And the difficulty is that the risk is embedded in your routine behavior, so it can often go by unnoticed. Reception staff capture patient details, files are moved between rooms, results are printed, emails are sent, and communication happens across multiple platforms. None of this feels outright risky. It feels like your day-to-day practice. But legally, every one of these actions is considered processing of personal information under POPIA. And in healthcare, we're not just dealing with ordinary personal information. We're dealing with what the law defines as special personal information, and that's the most protected category of data in line with POPI. This includes information about a patient's health status, mental health, reproductive health, chronic conditions, and other deeply personal aspects of their lives. And because of this, the legal expectation placed on a healthcare professional is significantly higher than in most industries. One of the simplest ways to assess your exposure is what I call the waiting room test. So I'd like you to imagine sitting in your own waiting room, not as a doctor, but as a patient. You arrive early, you sit quietly, you observe. What can you see? What can you hear? Can you see computer screens displaying patient information? Are there files placed at the reception desk? Can you hear staff discussing patient diagnosis within an earshot? Are printed lab results visible at reception? Each of these situations seem minor, but under POPIA, they can constitute unauthorized disclosure of personal information. And importantly, the law does not require intention. It only requires exposure of that information. And in our experience at Dr. Legal, most practices fail this test very quickly because, as you can see, the exposure is there. What is POPIA? POPIA is often perceived as complex, but at its core, it's a very simple question. Are you handling patient information properly and responsibly? The Act regulates how personal information is collected, stored, used, shared, and protected. But in healthcare, this obligation is heightened because of the sensitivity of the information involved. You're not just managing administrative data, you're managing information that can affect a patient's dignity, relationships, employment, and their overall well-being. And this is why POPIA aligns closely with your ethical duties under the HPCSA, but goes further by introducing legal accountability. When discussing POPIA, many people immediately focus on the financial implications or penalties. And while those are big and significant, with fines up to 10 million rand being imposed on healthcare practices, these are not the most damaging consequences. There is also potential criminal liability in serious cases, as well as civil claims from patients directly. However, in healthcare, the most critical consequence is reputational. Medicine is built on trust, doctors. And if a patient believes that their personal information is not safe within your practice, they may withhold important information from you, or they may delay seeking your care or follow-ups, or disengage entirely. And this means that POPIA is not just about compliance, it's directly linked to your clinical outcomes in your practice. POPIA defines a breach very broadly as any unauthorized access, disclosure, or loss of personal information. This includes sending information to a wrong recipient or patient, losing a file, or sharing data without the appropriate consent. One of the most important points to understand is that intent is irrelevant. Even if the disclosure was accidental, it still constitutes a breach. And this is why relying on staff to be careful is just not sufficient for your practice. Practices need structured processes and safeguards in place. Let's talk about WhatsApp. I think it's become a very convenient space for all of us to communicate, though it's becoming more and more common in healthcare practices to communicate on WhatsApp. In many practices, it's used for its convenience, sending an image, asking for a second opinion, or just quickly communicating with a colleague. Clinically, this can be incredibly useful, but the legal issue arises when identifiable patient information is shared without the proper consent or control. And once an image is sent, it can be forwarded, saved, or shared further without your knowledge. And at that point, you are no longer in control of the information. The problem is not the platform itself. It's the lack of structure, consent, and the control around how it's used. Reception is one of the highest areas in any the highest risk areas in any medical practice. A simple statement like, "Are you here for your HIV results?" can unintentionally disclose sensitive information to others in the waiting area. Doctors often view this as a staff issue. But legally, the practice is responsible for the actions of its employees. And this means that staff training, communication protocols, and awareness are essential components of compliance. Many healthcare professionals assume that data protection is primarily a technical issue that requires IT solutions. But in reality, most breaches that happen are actually behavioral, human-to-human behaviors. They result from everyday habits, such as leaving a file unattended, sharing passwords, or failing to verify recipients before sending emails. I don't know how many times I've received calls from clients, from doctors saying, "Anushka, we've sent the wrong blood test, or we've sent the blood test to the wrong patient. What do we do? How do we recall that email? They've opened it already. All of somebody else's information is now sitting with another patient." At that time already, you've already passed and contravened so much of a person's personal information. So these are things that happen on a day-to-day. The result from these everyday habits of leaving files unattended do pose a critical risk to you as the healthcare practitioner. But the advantage of that is that we can address them, and there are systems and structures available for you to put in place in your practice. Small changes in your practice can significantly reduce exposure, such as accountability, processing limitation, who has access to files and why. It should only be the most critical in the care of the practice that has access to files. Purpose specification, information quality, security safeguards, and also your data subject participation, meaning that you have the correct consent from your patients as to how you are sharing their personal information. Do you have consent from your patients to share communication on WhatsApp with them? Do you have the correct informed consent from them to possibly share their information with other doctors? Does your informed consent make provision for POPIA? There was an interesting case where a practitioner stored patient records on a laptop that was stolen. The device unfortunately had no encryption, no passwords, which meant that all the data was accessible. From a regulatory perspective, the key question becomes whether reasonable steps were taken to protect the information. If the answer is no, then the liability of the practice is increased very significantly. POPIA compliance is often misunderstood as a menial and tedious administrative task, and sometimes a burden. But in reality, it is about the control of your practice. Control over who has access to patient information, how it is stored, how it is shared, and who has access to that information. Once a practice has clear systems and safeguards in place, the level of risk reduces substantially. So I'd like to ask, if the information regulator walked into your practice today and asked you to demonstrate how you are protecting patient information, what would you show them? Do you have your POPIA manual in place? Do you have your PIA manual in place? Would you be able to point to policies, to training, and to your systems that have been securely tightened? Or would your answer be that you're relying on staff to be careful? Legally, that will not be sufficient, doctors, and we have to put the correct systems in place for your practice. So some of the key things that you would need to have in place would be the appointment of an information officer within your practice, that you've registered with the information regulator. By show of hands, are any doctors known to be registered with the information regulator, and do you have an information officer? One. Okay, that's scary, doctors. It's really scary, and I don't say this to put you in an alarming state, but the reality is that the information regulator will be doing checks. They are doing checks. They want to know that the special data is being taken care of. So these are some easy steps that you're going to be able to take on board as soon as today by aligning yourself with what it is that the information regulator is asking of you. You've got to update your consent forms. Do your consent forms make provision for the transfer and sharing of information? Your security safeguards, whether it's physical and it's still under a lock and key, or whether it's cybersecurity that you've got to have in place for your virtual and online appointments, that's got to be upped, and make sure that you are taking care of all of the patient information physically and in the online space. Training staff. So ultimately, your practice is not always being under your eye. You're sometimes not there, and patient files are being left on the counter. Your receptionist has access to who and where that can be shared. So staff training is critical, that everybody in the practice understand holistically what does it mean to be POPIA compliant. And then obviously to review your third-party providers. So making sure that your third-party providers are also POPIA compliant, that they are not sharing your patient's personal information to pharmaceutical companies or marketing companies, or putting together a database for events. So that's really what could and does happen, and you've got to make sure that everybody within your practice, even those who you are connecting to, have safeguarded how that personal information will be protected. Something very important that the information regulator will also look at is whether you have a breach response plan in place. So this is in the event that a breach of data does occur. What are your steps that you are taking as the practice owner to make sure that some form of accountability is met? So if a breach occurs, you have to ensure that you contain that to as much knowledge and certainty as you can, that you investigate the cause of that information breach, that you do notify the information regulator that a breach has occurred. It would serve in your favor to rather preemptively, in a way, I guess, throw yourself under the bus for what has happened, but at least you're taking the accountability. The information regulator will consider this a huge one as in when the investigation unfolds. And then, of course, to inform the affected patient if required, and most times that is. So you've got to make sure that you do that. And then just in closing, a final question. If the information regulator does visit your practice, and perhaps I shouldn't say if, I should say when, because the reality of it is that they are doing that, would you be able to demonstrate your correct consent procedures, staff training, that your data security is safeguarded correctly, and that you do have breach response protocols in place? And if you're unable to firmly account for saying, yes, I can do that, then I urge you, doctors, please connect with us. We really take pride in being able to prevent these kind of data breaches from happening. And I've also got a checklist that I would love to email and send to you that just gives you the guidelines of what it is that you need to have in your practice. So every patient interaction generates sensitive personal information, and your practice is responsible for how that's handled. There are 6 key things that every practice has to have in check. The appointment of the information officer, registering with the regulator, ensuring proper patient consent, implementing basic security safeguards, training of staff, and the reviewing of your third-party providers. Your common red flags would include visible files at reception, unsecured communication, shared passwords, and unprotected devices. If a breach occurs, it has to be contained, investigated, reported, and documented properly in your incident register. And ultimately, if you cannot demonstrate how you protect patient information, your practice is exposed. Thank you.
Thank you, Anushka. Let's breathe. It's another one of those regulatory things that is scary, yes, and that we need to know and don't have enough time for and don't have enough knowledge of, and all of these things. Anushka, let's both go on stage, because we've got a good 15, 20 minutes to ask you questions.
Awesome.
And let's use that. Anushka's here. Who wants to start? Who's got a question? Yes.
Hi. I just want to understand, you said that WhatsApping out is a data breach. Is it a data breach, or could it be a data breach? And if you could explain why.
Thank you. What's your name, Doc?
Samantha.
Samantha, thank you. So, the WhatsApp messaging itself is not a breach. It's the content of what may be sent. And if that content is what is classified as special personal information, then sharing that information, yes, does become a breach, does become a risk to your practice in terms of breaking what POPIA is asking of us to protect the personal information of a patient. Where you fit in as the practice owner is you have a duty to, number one, have your patient's consent. If you've got their consent, you can send pictures of their entire body to who you need to, provided that they have given you the consent to do that. So it comes down to, number one, the consent of the patient, and then, as I say, the content and the sharing of where that information is going.
Understood.
Okay.
If you directly WhatsApping the patient,
Yes.
are you saying you still need consent for that?
Yes. So it needs to cover WhatsApp holistically and broadly, then, whether you're communicating with the patient, him or herself, or sharing that information to a third party.
So then the logic would follow, we also need consent for email, to email
Yes.
them everything.
Your consent form needs to make provision for any form of communication that you're having with your patient.
Okay, I do think that it can go under legitimate interest or a contract. So I think a little bit just WhatsApp purely being data breach, it's a little bit scary to put that out there. But you can use other justifications. I think consent is just one way.
One way. I hear you. I think it's just the most practical in a doctor's setting.
Yeah.
I think it also comes down to where you're getting that consent. So your terms and conditions is it's a contract. It's a consent of some sort. the point behind WhatsApp is that it's so commonly used, it's so easily accessible, and we don't even think about it. Which is why the point is always very carefully made about WhatsApp, because we take it for granted, where it's a very effective communication process. Anyone else with a question? Yes.
Yeah. Thanks for giving me the chance to ask you a question, which I can't, it's a problem to me. My question is, who will be liable in this case? The laboratory emails or puts the results of a patient on an app and you lose your phone. So someone could get into your phone, or sometimes they email you results of a patient on your, well, we receive emails on laptops or even on phones. What will be the responsibility of the doctor in case of such an incident?
Thanks, Doc. That's an interesting scenario, but ultimately it does come down to you as the doctor. That's your device, and your device has to be encrypted and have the security checks in place so that in the event of that happening, that whatever data is stored on that device, that you can account for the fact that you have security mechanisms in place to safeguard any third party from accessing that information. So ultimately, it does still come down to you as the doctor, as the practice owner.
Do the laboratories, do they get consent to send their results to?
That's something that they also have to have in place. They have to have consent procedures in place from their side to share the lab results with the doctors. So it's not something I think that's at the moment being taken, I would say, to the 100% that it should be, but labs are needing to, because they are in charge of then processing that data and sharing that data. So 100% they have to have the consent from the patient, and that consent should make up part of the consent that you as the doctor ask the patient to consent to, that your lab results are going to come from XY lab, please give us consent for them to share that information with us. Or sometimes, and I've seen that now happen, do you want to receive those results directly? And then it bypasses the doctor and goes directly to the patient. Yeah.
I think that's quite tricky with all our automated systems now.
Yes, it is.
What I see as a serious breach is sending the results through a courier or their drivers. And those results, you find that in most cases, they are in one packet and they are different patients.
Absolutely, and those hard copies can easily be misplaced, and you're giving incorrect results to different places, and that has happened as well, Doc. Yeah.
So which would you say is safer, paper systems or digital?
Sure. I think they
Cringes.
both have their high-risk areas. I think in South Africa, we still largely paper-based trail, and so there's a larger risk of that information being shared. You know, having somebody like the receptionist have access to all the files within the practice, easily, oh, that sounded like an interesting diagnosis. Let me just go and quickly read. What did Mr. van der Merwe actually come in for? And then next thing that's being discussed at, the tea table around tea time. So I think both share an equal risk. As in my learning of what and where the data breaches occur, it's not through a hacking system. It's not somebody who's trying to obtain patient results, through your cybersecurity system. It's the human error, the human inquisitive nature of their mind to want to know, okay, who is this? What are they talking about? And I think I know that person. Let me just have a closer look. Most times our GPs are situated in community spaces, and so communities know each other, and they know names, they know surnames. And so when something is being spoken about at a reception area, it triggers the inquisitive nature of the mind for somebody to want to know, that sounds like somebody I know. Where does this come from? So I think more so I'm still leaning towards our current paper system having the most place for risks to happen. Yeah.
Right, we've got another question around here.
Just a quick one from me. POPIA in the state is just, it's a separate issue. Can I just ask, is there a separate clause that covers the state as an entity?
So you're talking about specifically in your consent forms, Doc, that would...
Not necessarily.
Yeah.
Basically everything. From the moment the patient walks in, all the way up to theatre, healing, wound care, and until they're finally discharged. Because the state and what I've just heard now, they're two completely different settings, and there is no way that I can apply what I've just heard now in a state setting. So that's why I'm asking, is there a separate, clause that covers the practitioner under the state?
So yes, Doc, and just to get into it a little bit, are you working in the state space as a private doctor?
I'm actually working in the state space permanently.
Yes.
I'm working in a very sensitive department which actually includes both theatre, procedures, and there's a lot going on. So that's why I actually want to know if there's anything that I need to read particularly on my side.
Absolutely. So the state's not excluded. And it's even more important and critical that the correct POPIA consent clause is included somewhere in the consent form, ideally, because as you say, you don't necessarily have the time factor to go through everything as you would perhaps in your private practice. But there is a consent clause that gives the hospital permission, number one, to obtain all of that information, and then guides the patient to understanding if this information needs to be shared with third parties, how that would happen, and obviously then gaining the consent of the patient to share this information with possibly other specialist doctors, maybe even outside of the hospital. It does need to be included, and I say consent form because that's usually the most effective way, and it's usually the first point of signing a document that a patient would have access to, and usually the only really, consent form, the only document that's binding the patient to the hospital. So yes, there does need to be a POPIA compliance clause in the consent form. Yeah.
So I was going to ask you, do you have a consenting process in your department? Okay.
We're involved in doing procedures all the time. So consenting is completely different. So what I'd like to know is specifically with regards to the POPIA, because we communicate with colleagues all over the country, all over, within the province, and it's very different. The setting is different, yeah. So, yeah.
So how I interpret that is, let's say one of your patient's data is breached and they complain somewhere. What is her risk? Considering, does this become a malpractice issue? Because she has no control over that consent form, the consenting, and maybe when, with permission, she sent it to Surgeon X, who then sent it to someone else.
In some way, I would like to say maybe you're a little bit luckier that your liability then becomes sort of handed over to the state hospital, because then they are the ones where that consent needs to have been correctly sent to a patient. So in a way, you kind of covered and fall under the umbrella then of the state's protection. But ultimately, it's got to be included in the consent form, whether you public, whether you private, to grant the consent of sharing that information, obtaining that information, and giving some guarantee that the information received is going to be kept and stored in a way that conceals the confidentiality of the patient. Yeah. Thank you.
Complicated systems, lots of processes. Anyone else?
Thank you so much for the great lecture.
Thank you.
Mine is a quick one. It's very connected to the gentleman's question there. To what extent are we going to be held liable for patient data or information? To as far as I'm concerned, the information that is stored within our practices and our hospitals, we are definitely liable. And we have to make sure it's secured, it is safe from harm, from anything, theft, and all of that. But he asked a very, very great question there to say, now information is in transit. To what extent are we held liable with regards to information that is in transit? I mean, we are not having much power over that. And I understand it's our patients. Well, it's the information that we actually had ordered for service providers to assist the laboratories to help us with it. But let's say maybe there's a leak in transit, or maybe it was not well secured. Usually they must seal the information, do all of that. Will I be held accountable as a medical practitioner in my practice should information get leaked while it's in transit? Thank you so much.
Thank you, Doc. That goes to one of the points that we did raise in terms of you as the practice owner also connecting with your third-party providers. So while I understand from your side you sharing that the breach doesn't come directly from you, it doesn't remove the accountability because you as the practice owner still need to connect with who your third-party providers are. You have to understand what their security systems are like, especially with a place like a lab, because the vulnerability and the sensitivity of what they are shifting and sharing is huge. And so you as the practice owner need to feel safe, number one, that you can entrust the information that's being shared with your third-party providers. And so that's why POPIA is so broad. It's not just directly to you as the practice owner, but everybody within your practice that you are outsourcing patient information to as well. And you have authority to then inquire from them, you know, what systems do you have in place for data breaches? Because ultimately, once information leaves my practice, it's now in your safety or safe care, as one would imagine. But the possibility for then a breach happening via a third provider can and does happen. And so it's important that as the practice owner, you don't sort of reduce your liability by simply saying, oh, well, that didn't happen from my side of things. It happened from a third party. Part of POPIA regulation is ensuring that your third-party providers are also POPIA compliant. Yeah.
And our last question.
Thank you for the talk. Practically speaking, the POPIA Act is not so easy for most of us, especially in the GP setup. For an example, I would like your opinion on this one. At times, when you're referring a patient, maybe from your practice to another facility or to another specialist, you'd state that you're referring so and so, it's a known, let's say for an example, it's diabetic or hypertensive. And in that instance, you are obviously you're comfortable sharing that. But in terms of somebody whose status, let's say it's HIV, you not disclose that. And you're putting yourself at risk if you'd be stating that, let's say on a referral or whichever system you are using, that I'm referring so and so with such a condition. And all your intention is all about, you want to benefit the patient so that whoever is going to be treating the patient next can do his level best. So can you help us there? How much of information can you share, and where do we draw the line?
Doc, thank you. I think ultimately it comes down to not what you share, whether you've got the correct consent to share. In your role as a doctor, you need to share everything, and you need to share in as much detail as possible. Your clinical notes that you're sharing over to a specialist need to be those verbatim clinical notes, and it contains very sensitive information. So it's not about not sharing. It's about making sure that your patient has given you the consent to share that information. And when you have that consent, you can rest assured that what you're sharing with a third party is safe, that you have gotten the consent from your patient to be able to do that. So ultimately, having that informed consent, giving you the right to share and to divulge that information with a third party, that sets you that sets you in the clear from a data breach because you've got the informed consent from your patient.
Thank you very much, Anushka. Thank you. Those were great questions. Thanks for engaging with our speakers. It's cool. Thank you for your time. It's always interesting to hear what can go wrong so that we know what to put in place. I hope you got the contact details there. If you do need help with this in your practice, this is the lady who's going to help you. Prevention is better than a cure. I have a small gift for you I'll pass on in a bit. And thank you for sharing your wisdom.
Thank you so much. Thank you.